I hope so. So I think we can continue with this presentation called A Breakthrough in Aesthetic Medicine with PCL biostimulant. So my name is Martin Bulik. And wait. It doesn't work properly. How to move it? Got it. Sorry. So I completed my medical degree in 2007 and earned my PhD in 2015. Since then, I founded and run my aesthetic medicine clinic in Brno, Czech Republic, specializing in injectables, biostimulants, and thread lifting. In addition to my clinical practice, I'm assistant professor at Masaryk University and actively involved in research, particularly focusing on the use of facial ultrasound in aesthetic medicine. I also work as a tutor for international medical students and collaborate on international and national research grants. As we age, one of the most noticeable changes in skin is due to collagen depletion. Also, facial aging results from multiple factors. The primary cause is the loss of collagen over time. Collagen is essential because it provides the skin, particularly the dermis, with its structural integrity and mechanical strength. Fibroblasts, as you can see on the picture, are the specialized cells within the dermis and responsible for collagen production. It leads to, as we old, the collagen production decreases, and it leads to reduced skin laxity, volume loss, and the gradual. We know the depletion process is further accelerated by factors like sun exposure and environmental stress and lifestyle choices. All right, so Gouri is oh, sorry, it was too much. So what is exactly Gouri? Gouri is a revolutionary biostimulant that uses fully liquid polycaprolactam, and this is very essential. It is specialized and designed for use in aesthetic other injectables. Gouri is unique in that it is fully liquid, which allows for even more and natural distribution throughout the skin. Its primary function is to stimulate the production of collagen, helping to improve skin quality, elasticity, and overall appearance. There is something we called 3S. It's spreadability due to its liquid nature. Gouri spreads evenly and smoothly throughout the skin. Sustainability, so Gouri offers long-lasting, reproducible effects, and its biostimulatory action provides gradual and continuous collagen production. And last but not least is the safety, because Gouri has excellent safety profile. Issues such as vascular compression, necrosis, and granulation formation are not reported in this type of stimulator. Yeah, so this is very crucial point. So what are the principles of Gouri? When Gouri is injected into the skin, the body interprets this as a mild trauma. This controlled microtrauma triggers the natural healing process. Gouri's active ingredient polycaprolactam is recognized as a foreign substance. However, due to its biocompatibility, it doesn't cause harmful reactions. Following injection, the body triggers a localized inflammatory response. This is controlled inflammation, and it activates various cellular processes essential for tissue repair. As a part of inflammatory response, chemical mediators such as histamines, prostaglandins, and cytokines, for example, are released. These compounds help to signal other cells and facilitate the healing process. Next, fibroblasts are the cells responsible for collagen production, and also macrophages are reactivated. Yeah. So all of this leads to collagenesis. It's the production of new collagen fibers in this process. And this is the ultimate goal of Gouri treatment. Let's take a look at the clinical evidence supporting Gouri's ability to stimulate collagen production. What you see here are histology specimens comparing tissue treated with a control product to those treated with Gouri. And the results clearly show significant changes in skin structure after Gouri application. One of the key findings of this study was the increase in skin thickness in the tissues treated with Gouri. This increase can be attributed to the higher collagen content in these areas. According to a histology analysis in the images on the right, there were found more densely packed collagen fibers compared to control specimens on the left. This identification of collagen contributes to the widening of dermal and subcutaneous layers, and the thicker dermal layers are observed by the sixth week can be directly linked to the process of collagenesis. This is the second study focused on improvement of dermal elasticity after Gouri application. And here we have a graph on the left showing the changes in elasticity over time. The R2 value measured using Catimeter 580 shows the skin's ability to return to its original shape after being deformed, which is a key indicator of skin elasticity. As we can see, there is little to no improvement in elasticity when the contraproduct is applied. However, after Gouri is introduced, a clear increase is observed between the second and fourth week. This elevation in dermal elasticity highlights the Gouri effect in restoring the skin nature resilience, and confirms a gradual and measurable improvement in skin elasticity attributed to neocollagenesis process stimulated by Gouri. This is clinical study focused on the effectiveness in Gouri in reducing the appearance of crow's feet, one of the most common signs of aging around the eyes. The results show on the top column graph demonstrate clear improvements over time. In resting state, there was a noticeable reduction in crow's feet by 4th week. Wrinkles continues to decrease steadily with a maximal improvement at 12th week. Compared to control product, Gouri showed a greater ability to reduce wrinkles. In terms of specific numbers, the crow's feet grading scale revealed an improvement rate of 48% in restrained state. Even more for dynamic facial expressions, such as laughing, the improvement rate reached 20%. This highlights Gouri's ability to enhance skin elasticity and smoothness, even in the most expression-prone areas of the face. So why are biostimulants leading way in aesthetics medicine today? Biostimulants like Gouri offer a minimally invasive approach to facial rejuvenation, avoiding the need for incisions or surgical interventions. This makes them highly appealing for patients who want to achieve significant results with minimum downtime. Also, the effects of biostimulants are long-lasting and consistent. With Gouri, the gradual stimulation of collagen provides results that are both durable and repeatable with minimal maintenance. There is an increasing focus on preventive medicine and treatments in aesthetics. Biostimulants allow early intervention, helping patients maintain youthful skin by addressing collagen loss before it becomes more noticeable. Another reason for the popularity of biostimulants is their versatility. They can be combined with other aesthetic treatments such as dermal fillers or thread lifting to create synergic effects. This combination allows for comprehensive facial rejuvenation without overloading the skin. Patients today are looking for subtle natural enhancements, and biostimulants provide gradual improvement that look more natural compared to other treatments, ensuring patients feel like the best version of themselves without appearing overdone. Biostimulants can be applied to various areas of the face and body, making them incredibly versatile. And whether it's improving skin elasticity, correcting fine lines, or enhancing volume, they offer multiple solutions within one treatment plan. Finally, biostimulants like Gouri have a low risk of complications. Issues such as granuloma formation or vascular compressions are rare or not reported, making them a safe option for a wide range of patients. Now let's take a closer look at what makes Gouri such a great option. One of the key benefits of Gouri is that it uses a fully liquid form of polycaprolactam. This allows for smoother integration into the skin avoiding the formation of granulations that can sometimes occur with other biostimulants. So no more nodule or lumps. Gouri is highly practical in clinical settings. It comes prepared in a syringe, ready to use, which makes it convenient for practitioners and reduce the complexity of the procedure. There is no need for premixing or dilution, ensuring consistent results with every application. The application process is straightforward and efficient. With just a few strategic injection points, the product spreads naturally throughout the skin. The simplicity saves time for both the practitioner and the patient. One of the standout features of Gouri is its spreadability. After injection, it can diffuse up to 4 centimeters from the injection site, covering a larger area with fewer injection points. And it makes the treatment less invasive while ensuring a border area is treated, leading to smoother and more consistent results. Gouri is not limited to facial treatments. Its versatility extends to body rejuvenation, offering same benefits for collagen stimulation in areas like neck, décolleté, and, for example, hands. It allows practitioners to offer comprehensive skin rejuvenation solutions with single one product. Finally, the results of Gouri are both long-lasting and sustainable. The collagen stimulation process, continues over time, with patient typically seeing improvements from up to 12 months or longer. Yeah. So these are the main results to use Gouri and start with that application. As it is usual, all the products has some contraindication. It's important to understand them and to ask your patient in advance. For example, patients with blood disorders or those taking blood thinners such as aspirin or anticoagulants should avoid Gouri. There's an increased risk of bruising, bleeding, or hematomas, and these conditions make our patients more prone to complication after injection. For those who are immunocompromised, the body ability to respond and heal after treatment may be altered. And this could result in unpredictable outcomes or prolonged recovery times. Patients with autoimmune disease have a higher risk of adverse reactions in general. Any patient with a known allergy or hypersensitivity to polycaprolactam or any other ingredients of Gouri should not undergo this treatment. The safety of Gouri has not been established in pregnant or breastfeeding women. If there is an active infection, Gouri should be postponed until the infection or condition has cleared. And the patients who have recently undergo facial surgery or other aesthetic procedures should wait before receiving Gouri injections. Now let's move on to the standard application protocol of Gouri. The application is straightforward and efficient, as we already said, but proper placement is key to achieve optimal result. In the first image on the left, we see protocol of 1 cc of Gouri. The recommended injection points are along zygomatic arch, spreading across the cheeks on both sides. For 2 cc application of Gouri on the right, an additional vector is introduced along the forehead on each side. And this additional injection point targets areas of the forehead where dynamic wrinkles are and lines often appear. By addressing the forehead along with the cheeks, we achieve a more comprehensive facial rejuvenation. The spreadability of Gouri allows it to diffuse up to 4 centimeters from each injection site, which means fewer injection points are needed to cover larger surface area. These are the main and very important information for doctors. I hope all of you already got these instructions. So the injection layer is in deep dermis. Recommended cannula size is 25G, 50 millimeters. And we use premedication of antihistamines 30 minutes before procedure. We usually prescribe corticosteroids for 3 days following to treatment to prevent any possible adverse events. And we are going to speak about it more later. It's usually just 1 or 2 sessions, but it depends on the results of your patient, and it's not recommended mixing with other products. Now let's look at some real-life examples of Gouri in action. These before and after cases demonstrate a remarkable improvements in skin quality, volume, and overall facial rejuvenation that can be achieved with Gouri. So we are we have a case focusing on skin texture and fine lines. The patient has visible fine lines around the mouth and nasolabial folds before treatment. After Gouri application, you can see a significant reduction in wrinkles and improvement in skin texture. It looks smoother, and overall quality is much more youthful and can say vibrant. This is another case with jawline reduction over 5 weeks after the procedure. Another young patient with a minimal jawline saggings. Let's say through our primary goal was from the view of preventive aesthetic medicine on patient request, but you can appreciate minimal jawline saggings improvement. skin lightening and hyperpigmentation size reduction. This is 60-year-old patient refusing lifting with severe jawline saggings. And after 10 weeks, we can appreciate partial reduction of this joining, wrinkle reduction, and skin texture improvement. This is a similar case after 10 weeks, where you can appreciate the jawline saggings reduction. Skin of our patient is visibly firmer and youthful, with wrinkle and nasolabial fold reduction. Here you can see on the year after photography, tighter and elastic skin with nasolabial fold and marionette reduction, and also crow's feet reduction. This was the case where we like to demonstrate skin texture and fine wrinkles improvement, and also the nasolabial fold and marionette reduction. There's also a kind of hyperpigmentation reduction. And let's go for the next case, which highlights the treatment of forehead area. The patient presented with vertical scar across the forehead. After treatment, we observe a smoothing effect starting as early as 5th week, with the scar almost completely disappearing by week 12. The increased collagen production in this area help restore the skin firmness and reduce its appearance. Finally, we have a case which illustrates Gouri's versatility beyond facial treatments. The patient had significant skin laxity and wrinkles in the neck area. After Gouri treatment, the skin is firmer, smoother, with reduction in lines. And this shows that the Gouri is not limited to the face, but can improve significant rejuvenation in other areas as well. Something about procedure tips. Preparation is everything. Before starting the procedure, it's essential to assess the patient. This includes identifying areas of collagen loss, understanding the patient's skin type, and reviewing any potential contraindications, as we said before. Recent surgeries or skin infections. Every patient is unique and has unique needs based on their facial anatomy and collagen depletion. And before proceeding, it's important to clearly explain the treatment process to the patient. And it also involves setting a realistic expectation about the results. Gouri provides gradual improvement in skin quality and elasticity, so patients need to understand that full results typically appear after a few weeks, with continued over time. Also, you need to discuss with your patient that this is not thread lifting or operation lifting, so to have realistic expectation is very necessary. If you are using facial ultrasonography, it can be a valuable tool to correlate the visual signs of improvement. Sonography can help to observe the effect of collagen regeneration and better understand how Gouri is working beneath the surface. Pay close attention to the details of injection size and the depth of injection. Gouri works best when applied strategically to key area, and ensure you inject into appropriate skin depth to stimulate the fibroblasts effectively without involving the deep layers. Oh, sorry. For patient comfort, consider using local anesthetics, such as lidocaine, along the vectors of injection. This only reduces, this not only reduces discomfort, but can also help prevent adverse reaction, especially when working with more sensitive patients. But to tell the truth, we use this approach very rarely. Edema and hematoma, we are going to discuss in the next slides. So, edema or swelling is a common post-treatment side effect, especially after injectable treatments like Gouri. Understanding the causes of edema and how to manage it effectively can help improve patient comfort and ensure optimal results. So any injection, including Gouri, causes microtrauma to the skin and underlying tissues. This can lead to minor bleeding, and the accumulation of fluid contributed to swelling. After injection, the body naturally responds with inflammation. Chemical mediators such as histamines, prostaglandins, and cytokines are released, leading to increased blood flow and swelling at the injection site. Part of the inflammatory response involves increased vascular permeability. The activation of fibroblasts and other dermal cells during the neocollagenesis process also contributes to swelling. The same is with macrophages respond to presence of PCL as a foreign substance. The volume of the product injected itself and its distribution can influence the severity of edema. Larger volumes or uneven distribution can cause localized fluid retention and disrupt osmotic balance. Some individuals are more prone to swelling due to the factors like genetics, existing health conditions, or susceptibility to infections. In these cases, swelling may last longer or recur, especially if an ongoing infection is present. This reaction can be lowered by applying ice packs to the treated areas immediately after injection, which helps to reduce swelling by constricting blood vessels and minimizing fluid buildup. For patients more prone to significant swelling, oral antihistamines and corticosteroids are usually administered, and in more severe cases, intravenous methylprednisolone combined with physiological solution can reduce inflammation even faster, especially if there is a considerable edema that doesn't respond to more conservative treatments. Now let's discuss lasting hematomas, another possible side effect following Gouri application. Why neocollagenesis is beneficial? It can actually slow down the natural resolution of hematoma. The formation of new collagen fibers may interfere with the body's normal healing process. When fibroblasts are activated, they begin to form collagen deposits near the injured blood vessels, and this can trap the hematoma, effectively slowing down its resolution. As a result, patient might experience longer-lasting bruising or blood accumulation at the injection site. There are several strategies we can implement to reduce the risk of hematoma formation and accelerate healing. It's important to advise patients to avoid blood thinners. Immediately after the procedure, cold compress should be applied to injection site if there is a larger hematoma. If it occurs, usually I need to shift entry point location to prevent this lasting hematoma. It's also crucial to educate your patients on what to expect in case of hematoma. If the hematoma persists for more than 3 weeks, changes color significantly, or becomes painful, patients should be advised to seek further evaluation to rule out any complication. For hematomas that are slow to resolve, laser treatments can be used. And topical applications such as heparate, arnica, and vitamin K creams can help to reduce the size and visibility of hematomas. After Gouri application, it's essential to follow proper post-treatment guidelines to ensure the results. It's important to advise patients to avoid alcohol for at least 24 to 48 hours post-treatment. Patients should avoid any form of excessive exercise during the first 24 hours post-procedure and exposure to excessive heat, such as showers, saunas, and so on. Applying a cold compress to the treated area immediately after the procedure can help minimize swelling and bruising. And it is recommended to administer medication according to Gouri guidelines. Patients should be advised not to massage the treated area, as this can interfere with product distribution and cause uneven results. It's generally recommended to schedule a follow-up visit around 4 to 5 weeks after the procedure to assess result, monitor healing, and determine if any additional treatments are needed for optimal results. Lastly, maintain open lines of communication with your patients. Encourage them to reach out if they experience unusual symptoms or have concerns post-treatment. Ensuring your availability helps to build trust and manage any procedural complication effectively. While Gouri has its standard application protocols, it's also highly versatile and can be used in various off-label areas to achieve additional aesthetic benefits. One of the off-label areas where Gouri can be effectively used is along the glabellar region. By applying Gouri across these lines, can stimulate collagen production and help smooth out those deeper wrinkles, reducing its severity over time. Another effective off-label application is in temporal fossa. As patients age, they often experience volume loss in this region, and treating along mandibular ramus, the vertical portion of the jawline, of lower jaw, is particularly useful in patients who are experience saggings or laxity along this area. Finally, applying Gouri along the jawline contour can help achieve sharper, more youthful definition. It is especially useful in patients who are beginning to experience jawing or a loss of contour around the jawline. In this slide, we introduce one of the clinical studies conducted in our institution. We are aimed to objectively assess the effect of Gouri on dermis and subcutaneous tissue thickness. One of the most reliable and non-invasive methods we used for this assessment was facial ultrasound. As you can see in the ultrasound image here, we are focusing on cheek area, which is commonly used, treated with Gouri. In the center of image, we are zoom in to highlight the measurement of dermis and subcutaneous tissues. These allow us to precisely measure the changes in tissue thickness both before and after treatment. Facial ultrasound provides us with a clear and measurable way to observe the widening of these tissue layers as Gouri stimulates collagen production. By tracking these changes, we can objectively assess the treatment effectiveness in real time. It offers a direct view of how dermal and subcutaneous layers thicken. In this study, we focus on consistent correlation between ultrasound measured thickness increase and the clinical improvements observed in patients' facial volume and firmness. These are the methods used in our prospective study, designed to assess the effectiveness of Gouri. We enrolled 30 women aged between 26 and 74 years, covering a wide range of skin types and aging stages to ensure a comprehensive assessment. The study followed the standard Gouri application protocol. For some patients, we used 4 vectors, each receiving 0.25 cc of Gouri. For others, we employed 6 vectors with 0.33 per vector. We use standard 25G 50 millimeter cannula, and which provides minimal trauma. And as you can see here, we measured the 3 distinct locations on both right and left side of the face. To track the process over time, measurements were taken on day 0 and during follow-up examination on days 22 to day 105. Here we present the ultrasound images used to verify the effect of Gouri in various facial regions. These images allow us to objectively visualize the changes in dermal and subcutaneous tissue thickness. In the first 6 images from the left, you can see examples of ultrasound scans from that design location, DX1, DX2, DX3 on the right side, and sinister 1 to 3 regions on the left. These areas were part of the standard measurement protocol of the study. Throughout the scans, we clearly observed a thickening of both dermis and subcutaneous tissue following Gouri application. The final 2 images show ultrasound scans of the forehead on the right. While this region was not a primary focus of our study, a few patients did receive Gouri in this area. Even though we didn't include it in our standard measurements, these images show similar tissue thickness effects, confirming that Gouri can be effectively applied to the forehead as well. Now let's review the key findings of our study, which demonstrated statistically significant increase of dermal and subcutaneous tissue thickness after Gouri application. On average, there were an increase of 1.02 millimeter in the thickness of dermis together with subcutaneous tissue, which represents a 39% increase from the initial values. This change is highly significant with p-value of less than 0.001, indicating strong statistical confidence that these results are not due to the chance. Focusing specifically on the dermis itself, we observe a mean increase of 0.22 millimeter, corresponding to 17% increase, again with p-value less than 0.001. These findings highlight the powerful effect of Gouri in stimulating collagen production and thickening both dermal and subcutaneous layers of the skin. As shown on the table below, we applied the Wilcox-Sign rank test with continuity correction. This slide provides a visual representation of data we collected, highlighting the increase in tissue thickness following Gouri application. In the first main graph on the left, you can see the changes in combined dermis and subcutaneous tissue thickness in millimeters, measured before and after Gouri application. The graph clearly shows a significant increase in tissue thickness across all the patients. The second main graph below focuses solely on the thickness of the dermis itself, excluding the subcutaneous tissue. Again, we observe a consistent increase in dermal thickness. On the right, there are 6 subgroup graphs from representing thickness changes in that 6 specific areas, 3 on the right and 3 on the left sides. One of the most important aspects of our study was observe the time-dependent nature of tissue thickening process after Gouri application. The first graph on the left shows the increase in combined dermis and subcutaneous tissue thickness on average by 0.1 to 7 millimeter per week after Gouri treatment. The second was focused on the dermis alone, where we observe an average increase of 0.029 millimeter per week. Both the graphs simulate that linear progression of tissue thickness increase. So while our study shows strong, statistically significant results in many areas, there were also some factors that did not show statistically significant effects on the outcomes. Interestingly, the volume of Gouri applied, whether it was 1 or 2 cc, did not have a statistically significant impact on the overall tissue thickness increase. This could suggest that both volumes are effective, and the choice between them might depend more on patient preference or the specific treatment area rather than a difference in efficacy. Age, which we might expect to play a role in collagen stimulation, did not statistically affect the results in our study. We also found that the initial thickness of dermis and subcutaneous tissue did not significantly influence the degree of tissue thickening. Patients who had previously received biostimulant treatments did not show a statistically significant difference in their response. Finally, it's important to note that one limitation of our study was the limited number of patients included, which may have affected the statistical power in some areas. With a larger patient sample, we may have been able to detect more subtle differences in these non-significant results. In conclusion, our study provides clear evidence of the effectiveness of Gouri in stimulating collagen production, as demonstrated by increase in dermis and subcutaneous tissue thickness after treatment, using a simple and objective assessment method like facial ultrasound. One of the limitations of our study was relatively small sample size. So for further direction, we would recommend to include a larger sample of included patients. To further strengthen the evidence is a good method to go for double-blinded prospective study. We could further also include a subject stratification to get some concrete results. And another potential area of future research is the establishment of some threshold values, which could be very interesting in your daily practice. In our study, we follow up to day 105. However, conducting a long-term follow-up would allow us to evaluate how durable Gouri's effects are over several months or even years. One of the exciting aspects of this research is the potential to demonstrate these results in your daily clinical practice. By using facial ultrasound as a tool to track treatment outcomes, we can provide patients with objective evidence of their progress over time, enhancing patient satisfaction. Finally, it would be valuable to explore the possibility for correlating Gouri with other biostimulants or treatments. In this slide, I'd like to share a rare but insightful case involving COVID-19 infection that exacerbate the nature inflammatory response after Gouri application. As we know, the standard mechanism of Gouri involves an inflammatory response following the injection. It leads to the release of histamines, prostaglandins, cytokines, which increase vascular permeability, activate fibroblasts, and other dermal cells. Macrophages respond to treatment, but its contribution can sometimes alter osmotic balance. In this case, we treated a 47-year-old female patient using standard protocol of 2 cc of Gouri with 0.33 per vector and applied 3 vectors on each side of her face with 2 entry points using 25G 50 millimeter cannula. Prior the procedure, she took cetirizine, and I prescribed 3-day course of 10 milligram prednisone. However, shortly after the treatment, the patient contracted COVID-19 infection. As we know, COVID-19 can significantly exacerbate inflammation due to its effect on body's immune system, and the patient's natural inflammatory response to Gouri was intensified by infection, leading to increased swelling and prolonged recovery. This case highlights the importance of considering systemic infection like COVID-19. To continue the discussion of this rare complication, the patient developed COVID-19 on day 4 after the Gouri application, confirmed through a PCR test. On day 7, we performed a facial ultrasound to further investigate the extent of swelling. The ultrasound revealed large areas of diffuse subcutaneous hypervascularity, including increased blood flow and inflammation in treated areas. Importantly, we are able to exclude the presence of phlegmona or abscess formation, which are more serious complications. In addition to prolonged swelling, the patient reported worsening pain, for which we managed with non-corticosteroid antiphlogistics, but we avoided the use of corticosteroids in line with COVID-19 management guidelines, as they can potentially interfere with body's ability to fight the infection. By day 11, the swelling had reduced significantly and was limited to malar area. And by day 14, the swelling had completely disappeared. Also, we don't typically see complication of this nature. The patient's case turned out to have a surprising silver image. As you can see in these before and after photos, despite prolonged inflammation caused by COVID-19 infection, the Gouri treatment actually led to good result. In this case, we provided ultrasound measurement, and the patient experienced even 37% increase in both dermis and subcutaneous tissue thickness. So, why we know that Gouri stimulates collagen production through a controlled inflammatory response. The inflammation triggered by COVID-19 appeared to have further enhanced this effect. So this brings up an interesting discussion about the balance of inflammation. On one hand, a controlled inflammatory response is essential for stimulating collagen production and achieving desired aesthetic results. On the other hand, if the inflammation becomes excessive, it can lead to tissue damage and prolonged healing, and even complications like fibrosis or scarring. So fortunately, in this case, while the inflammation was more intense and lasted longer than usual, we were able to manage it without leading to any long-term damage. Instead, the control aspect of inflammation eventually led to increased collagen production. This is the ultrasound image where you can clearly see the severe hypervascularity in both dermis and subcutaneous tissues as captured by Doppler ultrasound. It's a very valuable tool because it allows us to visualize the increased blood flow. This extreme hypervascularity further explains prolonged and excessive swelling we observe in our patient. Normally, we expect some level of vascular activity following Gouri application. However, the combination of Gouri's effect and systemic inflammation from COVID-19 infection significantly increase vascular activity beyond what we typically see. So for this next part of presentation, I'll show you a pre-recorded demonstration of Gouri application, highlighting the partial aspects of the treatment protocol. In this case, the patient had clear indications for Gouri because she refused operative or thread lifting procedure, preferring a minimally invasive approach. area with wrinkles, and we're gonna reduce it using Gouri biostimulation. So you can have a seat, just feel comfortable, and we're gonna start with our field preparation with cleaning anesthetics. So we usually use Kutaset disinfection solution, and we clean entire area. So as we have chosen a longer 70mm long cannula with an aim to cover a bit of or upper part of the hole, we're gonna choose the entry point a bit more far from medial line, somewhere here. This is the first vector, second, and the third one. Same location on the opposite side. First, second, and third. So we start with local anesthetics. We have chosen suprachind anesthetics with adrenaline, which is our favorite product in this application because it stops or reduces capillary bleeding, and then all the procedure is much more safer due to reduction of bleeding, and one of the most common complication in Gouri applications is hematoma in the entry points. So I have choose soft fill cannula with easy guide applicator, and it's much more easier to introduce your cannula into your entry point. So we're gonna start with the first horizontal vector, and we need to approach the cannula near to midline. We always need to count that the product spreads approximately 4 centimeters from the point of application. So it's not necessary to lead your cannula into the midline, just near to it. So we are somewhere here, and then we continue with a retrograde application, and into each vector we will apply 0.33 cc. So then we are going to continue with our second vector. Gouri is very strong biostimulator. So we need to explain our patients that the application with Gouri can be a bit painful. So is everything okay till now?
Yeah.
All right, thank you. So this is our third vector, and the rest of our first syringe. So as you can see here, we haven't caused any severe hematoma, and that is also a reason why we use suprachind anesthetics with a part of adrenaline inside. So on the left side is our second entry point. Again, we're going to use Easy Guide. It's very simple to get inside, and we're gonna continue with our first horizontal vector as on the right side before, leading your cannula somewhere near to midline, and then with retrograde application. And then the procedure is same in your second and third vector. Last vector and last retro. Sorry, something happened with the video. For today's Gouri session, we have chosen a beautiful 61-year-old lady. Oh my God. With severe laxity of the skin So I'm sorry, it started again. So I think that you got the view of the procedure, and I will continue with some take-home messages. Gouri has proven itself to be an effective biostimulator for enhancing collagen production. With its ability to naturally stimulate the skin regenerative processes, it delivers long-lasting and natural results. Gouri provides safe, non-invasive option for patients seeking for facial and body rejuvenation without the need for surgery or extensive downtime. It's used to fully liquid polycaprolactam allows for even distribution and minimal side effects, making it ideal for patients who prefer subtle gradual improvement. While Gouri is highly effective, success depends on proper injection techniques and post-treatment care. Ensuring the product is placed correctly and following up with appropriate care are key to achieve the optimal results. Also, Gouri has shown excellent results in clinical practice. There is always room for further research. Additional clinical trials and studies will help support Gouri's efficacy and expand its application in aesthetic medicine, potentially uncovering new uses or combinations with other treatments. It has its crucial role in preventive aesthetic medicine, and it was proven by its results. So, thank you for your attention and for taking the time to learn more about the exciting possibilities that Gouri offers in aesthetic medicine. I hope the insights shared today help you better understand its potential to transform your practice and improve patient outcomes. Please feel free to reach out if you have any further questions or would like to discuss this in more detail. I'm always available to share my experience, explore collaboration opportunities, or provide guidance on Gouri's application. So looking forward for continuing the conversation and exploring new ways to push the boundaries of aesthetic medicine together. Thank you very much.
We got some questions in the chatting window, so I think we can cover some.
Mm-hmm. Where to find it?
You can find the chat on the bottom of the window.
Right. So the first question is if it is diluted or what is the dilution? This is the main goal of the Gouri, because the syringe is ready to use, so you don't lose any time by mixing or waiting for some dilution. Yeah, it's ready to use, and you can apply it when you open the package. So another question, please leave the question here if there is any. No, Celine, it's from you, sorry. So the next one is any precautions for glabellar injection? Not at all. I think it's quite simple, and the main problem can be just hematoma, but there is no room for any necrosis, no room for nodes and other problems caused with other injectables. Yeah, so it's fully liquid form, and this is crucial for any adverse events which could be expected. Any precaution for submental area injection? Again, it's very safe product, yeah, and we can expect edema or hematoma, but we already know how to manage them, and so this is it about. Inform your patient and be prepared to answer their questions. Is there any dilution? So we covered this question already. Any precaution for it injection? So it was covered also. Is there data on combination of this product with collagen stimulating laser procedures? And is there a protocol in combination with biorevitalization? As we don't use lasers in our clinic much, so I don't feel that I'm an expert in this question. But as it was said, usually we wait, for example, for being after another aesthetic procedures. But to tell the truth, I don't feel expert in laser treatment, so maybe you can ask later again. Thank you. And can it cause anaphylaxis? I think generally any medication, any product which is injected into human's body can cause this. Yeah, so you need to forward the severity of this adverse event, and you need to provide specific treatments. Yeah, I don't think that there are any severe reported anaphylactic reactions, but we all know that the human body is never 100%. Another question. Thank you for the information. Very interesting product. Another. Can it be done once in a month for 6 months? I have used it and I really like the effect on my skin. Usually we perform follow-up control in our institution, and depending on time, it's somewhere between 4 to 5 weeks after application. And then we like to describe the changes and improvements and decide whether to continue with another session or not. Usually we are satisfied with 1 to 2 sessions, but distributor advises that it could be even 3 sessions following the application. Is there any antidote for Gouri in case of complication? I don't think that there's any antidote needed. Yeah. So if it is fully liquid, it doesn't complicate with any nodes or nodules, and you know, it has the similar safety profile. I don't think you need any antidotes. Yeah, we are not speaking about something which could cause necrosis or vessel occlusion. Yeah. So to tell the truth, we experienced several adverse events, but they were not severe. They were minor, and the product is very, very safe. And the last, thank you. So this is also my thank you to your attention, and that was very pleasure to have such a session today. Thank you very much.